I'm Dr. Michael Allon, Medical Director of Advanced Fertility Center of Texas. There are several reasons why IVF fails. One of them is what we call ovarian stimulation. The amount of medication or gonadotropins in which we give our patients can actually affect the growth and the development of their embryos. Sometimes if we give a lot of medication or hormonal stimulation, there is rapid growth of the embryo and then leads to poor embryo development or even genetic abnormalities. Each patient has to be individualized as to the amount of medication they're given for their IVF treatment. We also encounter a phenomenon which we call cycle-to-cycle variability. This means that in some months the woman may stimulate her ovaries and we can get good quality embryos, and in the second month we just use a little different type of stimulation and we can obtain better embryos. Another reason for IVF failure is due to poor egg quality. This typically occurs in women who have low ovarian reserve, or typically we see that with intramullary hormone that is low, or in women who are typically over the age of 37. What happens when we have a low ovarian reserve? The amount of good quality eggs is low, and then we have poor embryo development due to egg quality. Another reason for IVF failure is a uterine factor. Sometimes in the uterus we encounter things like polyp or small growth inside the uterine cavity, uterine adhesions, or what we call uterine fibroids or myomas. These factors can definitely contribute to the growth of the embryo and the success of pregnancy. In order to avoid these factors, we typically perform a hysteroscopy in which a camera is placed inside the uterine cavity prior to embryo transfer and then eliminate those factors. Another reason for IVF failure is what we call due to uterine synchronization with the embryos. Sometimes the uterus is not synchronized at the same time of the embryos that are frozen in order to achieve implantation. We use an investigation by testing the receptivity of the uterus in order to identify the proper timing for implantation. In this test, we give the woman 2 weeks of estrogen and approximately 6 days of progesterone, perform an endometrial biopsy, and then send that to the lab. In the lab, they'll basically identify the timing for proper implantation, whether it's too early or the women will need an extra 12 or 24 hours in order to achieve implantation. To answer the difficult question of what can I do to improve my IVF, we ask our women if they can to improve their lifestyle by using lifestyle modification program, proper nutrition, supplementation, and exercise. At Advanced Fertility Center of Texas, we work closely with Lisan Wellness Center. At Lisan Wellness Center, there's an array of programs that improve the nutrition with lifestyle modification and other programs such as acupuncture to improve the chance of conception. With acupuncture, we found that our patients can tend to relax and hopefully improve the blood flow to the uterus and then achieve better successful outcome. If you have any further questions or would like to inquire about our treatment, please contact us at 713-467-4488 or at infertilityanswers.com. I'm Dr. Michael Allon, and on behalf of the Advanced Fertility Center of Texas, we're here to help you.